Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're taking a look at how one Lowcountry plastic surgeon repairs nerve damage to a reconstructed breast.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, Dr. Craigie. We're here at East Cooper Medical Center. Thanks so much for having me.
Thank you.
All right, so today we're talking about nerve repair in the reconstructed breast. Before we get into the nerve repair part, talk about what is a reconstructed breast.
Well, a reconstructed breast is a breast that's been restored after a woman's had her breast removed.
Okay.
And it can be removed for preventive reasons so she doesn't get cancer, or it can be removed in the treatment of cancer.
Okay, and y'all are basically cutting edge when it comes to different ways to do this process. Real quick, talk about the fact that, you know, you're using your own tissue and things like that. It's much different from the other people in this field, correct?
Correct, correct. And so we use the patient's own fatty tissue, and we do that by reconnecting. We separate the tissue from the body, and then we reconnect the blood vessels to blood vessels that are normally going to the breast. And so we restore the patient's natural breast with something that is very similar to the breast. So therefore, in the end, it's a more natural result that's permanent, that lasts, and they don't have to give up important muscles.
Okay, so when we're talking about nerve repair, what kind of scenarios would you have when it comes to that?
Well, for example, when a woman goes through a mastectomy, the nerves that give the breast its sensation, the sensation of touch and everything, gets removed with the breast as it runs through the breast. And so the skin that can be preserved, or the reconstruction that results, is often without sensation.
Wow.
So it may look very natural and it may look very good, or may be a nice result with minimal scarring, but there's a very good chance that it will be numb and no sensation.
Do you find that a lot of people think that they have to sacrifice that in order to get back to what they were looking like before? You know, they just feel like, hey, listen, I just have to I look the same, it doesn't necessarily feel the same, but you're basically giving it where they don't have to sacrifice one, correct?
Well, it has to be sacrificed. In other words, the nerve gets removed or divided in order for the breast to be removed. So the surgery has to be thorough and remove the breast tissue, but preserve the skin of the breast on some level, sometimes more skin, sometimes less. So there will always be a change or decrease of sensation. Well, when the nerve is removed, most of the breast is as well, but the skin left behind can be numb. And so there are different ways to do breast reconstruction. And so when you use your natural tissue, you restore the breast with fatty tissue, and that gives a natural result and shape. However, it doesn't always help with the sensation. So what we're working to do is trying to create a resensation of the breast. In other words, reconstruct the nerves that have been divided.
Okay, so, all right, clarify this for me though. Is this after they've already had so they've already had breast reconstruction? Are you going back in and repairing the nerve? Is that how?
No, this is at the time of the reconstruction.
Okay,
so
okay.
When you use your own tissue and natural tissue without taking the muscles, you can also take sensory nerves from the area where you're getting the fat. And you bring that to the chest. And in the process of connecting the blood vessels that restores the blood supply to that tissue, at the same time you then restore the tiny nerves, or you reconnect the nerves. And so when you do that, it doesn't immediately return to sensation, but then it aligns the nerves so that they can heal, and so that sensation can return, so that the end result can be a more normal breast.
And so for the folks at home who may have gone through a mastectomy, correct, and are considering doing this, what are some of the things that you see that mentally they have to overcome before?
Well, I think it's important for a woman who's going through treatment or surgery that requires a mastectomy to understand what is going to happen and what her options are for reconstruction. And so before doing or deciding to go through the mastectomy, or they may not have much of a choice, they should at least know what the different options are for reconstruction. Two different types, one with implants, another option with your own tissue. And so when you use your own tissue, you're more likely to get closer to normal sensation, and you also have the opportunity to reconstruct the nerves because your own tissue that you're using to make the breast has sensation. And so you can transfer that to the new breast as part of that process at the time. And so that's typically done when the mastectomy is done, or it can be done later. So some women have reconstruction after their mastectomy at a later time. Certainly, ideally, it can be started when they have their mastectomy.
So it's crucial though that they educate themselves in all aspects and what their options are after, correct?
Correct. Before they go through the mastectomy, understand, well, how does this need to be done? What are my options? Is, how the mastectomy can be done, and then also my options for breast reconstruction. Okay,
so Dr. Craigie, as far as repairing the nerve, are you able to repair the nerve if they use implants?
No, that's one important distinction between the two. With reconstruction using an implant, you cannot repair the nerve. When you use your own tissue, you're able to do that. In other words, the tissue that you use has nerves. So we bring the tissue that includes fatty tissue, skin, blood vessels, and the nerves to become a new breast. And so instead of just hooking up the blood vessels, we also reconnect the nerves. So as that heals, then the sensation can be restored. The goal to be normal, but many times it's improved and trying to get a more natural result.
All right, well, Dr. Craigie, thank you so much for joining us. And for more information, you can go online to eastcoopermedctr.com.